Were you aware that the posture you adopt for sleep tonight might be silently accelerating your aging process, robbing precious years from your heart, your mind, and even your personal autonomy? It sounds incredible, yet based on fresh studies from the National Institute on Aging, specific sleep postures may raise your danger of strokes, cognitive decline, and persistent agony by over 60%. And here is the detail nobody discusses. The majority of seniors are making this mistake every single night without comprehending it. For millions of older individuals, slumber has become increasingly challenging with age, involving tossing, turning, and waking up drained or aching. But consider if the issue isn't the duration of your rest, but rather the manner of your rest. Researchers now assert that your sleeping alignment can either mend your physique or gradually dismantle it. It has the power to soothe your joints, shield your backbone, and enhance circulation. Or it can achieve the precise reverse. Tonight, we are delving deep into the reality, the 4 most detrimental sleeping positions you must avoid after age 60, and the 4 superior ones that can replenish your energy, sharpen your memory, and even help you rise feeling years younger. Remain with me, because the information you are about to uncover might alter how you sleep forever. Before we begin, if you have not subscribed yet, I suggest you click that button and activate the notification bell so you never miss another wellness tip crafted specifically for you. If you appreciate this video, type 1 in the comments. If not, type 0 to inform me how I can create superior content for you. Part 1. The 4 worst sleeping positions for seniors. 1. Sleeping on your stomach. The face-down position. It might appear soothing initially, lying belly down with arms buried beneath the pillow, floating away as though the world cannot touch you. Many older individuals, like Mr. Harold, a 72-year-old retired builder from Ohio, claim it is the sole method they can use to doze off. "It seems like my back loosens up," he once mentioned to his physician. However, what Harold failed to understand was that this relief was silently harming his neck, his vertebrae, and even his respiration. Night after night, resting on your belly may appear innocent, but for seniors, it creates a silent stress on some of the most delicate areas of your anatomy. When you twist your head to the side for hours, your neck muscles contort unnaturally, restricting blood supply to the brain and compressing fragile nerves along the spinal column. Over time, this results in persistent rigidity, headaches, vertigo, and that all-too-common numbness in your hands or arms upon waking. According to the American Chiropractic Association, this stance raises the danger of cervical misalignment, a disorder that can create long-term stability and coordination difficulties, which is particularly perilous for older adults. And the damage does not end there. Pushing your chest into the mattress restricts how thoroughly your lungs can inflate. Your diaphragm cannot shift freely, compelling shallow respiration throughout the night. For someone past 60, this implies less oxygen arriving at your heart and brain, which can aggravate exhaustion, cloudy thinking, and even elevate blood pressure. Even worse, sleeping face down places unnatural stress on your lower back, particularly if you already battle with spinal arthritis or slipped discs. Dr. Emily Rhodes, a specialist in geriatric sleep, terms it the most aging posture for the backbone. She clarifies that over time, it hastens the degradation of the vertebrae, similar to bending the identical tree branch until it eventually snaps. So, while stomach sleeping might feel snug, it is silently robbing your comfort in the long run, one unquiet night at a time. But if lying on your belly is so damaging, what about curling up on your side? It feels instinctive, even reassuring, yet it conceals its own perils. Let us reveal that next. If you are still watching and finding these revelations useful, please comment number 1 below. to inform me you are with me. Now, let's proceed to point number 2. 2. Sleeping in a fetal curl, knees to chest. It is a stance that feels recognizable, almost childlike. Many older adults tuck into a compact ball at night, knees pulled up to the chest and arms held close, as if to shield themselves from the outside world. For Mrs. Eleanor, a 68-year-old grandmother from Michigan, this was her lifelong custom. "It feels secure," she stated, "like I am hugging myself to sleep." But after years of rising with breathlessness, back rigidity, and growing weariness, her doctor unveiled a shocking reality. Her cozy posture was silently stifling her body every night. Resting in a tight fetal ball may soothe the mind, but it quietly constricts the physique, particularly for seniors. According to the National Sleep Foundation, when your knees are drawn too near to your chest, your diaphragm becomes squeezed, decreasing lung expansion. This restricts oxygen intake, compelling your body into shallow, rapid respiration. And for older adults whose lungs are already less flexible, this subtle dip in oxygen can result in chronic exhaustion, morning headaches, and even stress on the heart. However, the hazards do not end with breathing. Curling tightly for hours forces the spine into an unnatural C shape, shortening the muscles and ligaments that maintain posture. Over time, this causes spinal curvature to deteriorate, making you appear more hunched, less steady, and more susceptible to falls. Dr. Leonard Hayes, a spine expert with over 30 years of practice, cautions, for seniors, sleeping too curled up is like spending the night instructing your body to shrink. Eleanor's narrative is a caution for many. What started as comfort gradually became a routine that plundered her energy and carriage. The fetal curl may feel like protection, but for aging frames, it is a snare, one that steals strength, breath, and stability night after night. So, if curling up feels so incorrect, what about lying flat? Like the soldier position many doctors once commended for spinal wellness. It might startle you, but that too bears concealed risks that few seniors understand until it is too late. 3. Flat on your back with no support, the soldier position. For decades, physicians used to claim that lying flat on your back was the healthiest method to sleep. Straight spine, even weight distribution, perfect alignment. But for older adults, the reality is far more intricate and significantly more perilous. What once appeared like a stance of discipline and order can silently become a nightly struggle for your heart, your lungs, and even your brain. Consider Mr. Robert, a 74-year-old ex-serviceman from Florida. A proud man, he had slept like a soldier his entire life, flat on his back, arms by his side, head barely on a cushion. But as the years went by, his wife started to observe odd occurrences. Long stops in his breathing at night, loud gasps for air, and mornings where he awoke drained and lightheaded. When Robert finally visited a sleep expert, the diagnosis stunned him: severe obstructive sleep apnea. His own sleeping posture was blocking his airway up to 30 times per hour. When seniors lie flat on their backs without appropriate head and neck support, gravity permits the tongue and soft tissues to collapse backward, narrowing the air passage. This leads to snoring, choking, and interrupted breathing, sometimes without the sleeper even perceiving it. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over 60 can raise the danger of stroke, heart attack, and memory loss by more than 60%. It also elevates nighttime blood pressure, quietly taxing the heart as it fights for oxygen. But that is not the sole risk. Lying flat also aggravates acid reflux, a disorder that impacts nearly half of adults over 65. When your head is level with your stomach, gravity no longer keeps digestive acid where it belongs. It creeps upward into the throat, burning the esophagus and disturbing sleep. Over time, it can even harm the vocal cords and lungs, which doctors term silent reflux. For Robert, the alteration came too late. Years of poor sleep had already extracted their price. Constant fatigue, forgetfulness, and high blood pressure that refused to fall. His tale reminds us that sometimes stillness conceals danger. And if sleeping flat can quietly harm your heart and brain, what about sleeping half-sitting, the recliner position? You might be shocked to learn how this seemingly cozy arrangement could slowly enfeeble your body from the inside out. If you are still watching and finding these insights valuable, please comment number 1 below to let me know you are here. Now, let's continue with point number 4. 4. Sleeping in a recliner chair every night. It begins innocently enough. For many seniors, the recliner feels like a godsend, a soft, easy spot to rest sore joints, watch television, or take a brief snooze. And when lying flat in bed becomes painful due to backaches, arthritis, or acid reflux, that same recliner slowly transforms into a permanent bed. But as soothing as it feels, sleeping in a recliner every night is one of the most hazardous habits older adults can slide into. Take Mrs. Dorothy, a 79-year-old widow from Arizona. After years of chronic hip agony, she discovered she could finally sleep through the night in her recliner. But over time, she observed her legs puffing up, her back stiffening, and her vitality fading. What she did not realize was that her cherished chair was slowly sabotaging her health. According to Dr. Michael Turner, a geriatric rehabilitation expert, sleeping in a recliner keeps your body in a semi-seated posture that restricts blood circulation to the legs. The result is fluid retention, swollen ankles, and in severe instances, deep vein thrombosis, blood clots that can travel to the lungs and become life-threatening. The partially upright angle also stops your spine from fully loosening, causing chronic lower back tension and hastened muscle weakening in the hips and abdomen. Over months or years, this leads to stability issues and a higher danger of falls. Worse still, because the reclined stance limits deep sleep cycles, your body never truly replenishes itself. You might shut your eyes for 8 hours, but your brain and muscles stay in a constant state of light rest, never reaching the healing, memory-forming stages of sleep your body desperately requires after 60. Dorothy eventually went back to a regular bed after a doctor cautioned her that prolonged recliner sleeping could reduce her life expectancy. She stated, "I thought I was resting, but I was slowly shutting down." So, if the recliner isn't safe, where is the optimal place to rest? The answer resides not just in your bed, but in how you position your body. And in Part 2, we will explore the 4 sleep positions that can truly heal, restore, and shield you from the inside out. Part 2. The 4 better sleeping positions for seniors. 1. The supported side sleep with a pillow between the knees. It is one of the most basic changes you can make, yet for seniors, it can alter the way you rest and wake up each morning. Sleeping on your side with a soft pillow gently resting between your knees may appear ordinary, but for your spine, joints, and heart, it is one of the most potent healing positions you can select. Take Mr. Allen, a 71-year-old retired firefighter from North Carolina. For years, he awoke every morning with a dull throb in his lower back and hips. Pain medication helped slightly, but the stiffness always returned. During a routine checkup, his physical therapist asked him a simple query: "How do you sleep?" Allen replied, "On my side, knees together." That night, under her guidance, he tried slipping a small cushion between his knees and adjusting his head so that it aligned with his spine. Within 2 weeks, his pain had diminished by nearly half. "It is like my body finally exhaled," he said. There is genuine science behind this. According to research from the Cleveland Clinic, side sleeping, particularly on the left side, promotes superior blood flow to the heart and lowers acid reflux by keeping the stomach below the esophagus. The pillow between the knees keeps the pelvis level, alleviating pressure on the lower spine and hips, two of the most frequent pain points for adults over 60. It also minimizes the twisting that creates morning stiffness and joint inflammation. Doctors call this posture the alignment saver because it naturally supports the curves of the body without stress. It is also one of the safest positions for those with sleep apnea, as it keeps airways open through the night. Mr. Allen's story is not rare. Thousands of seniors have discovered that this tiny adjustment can mean the difference between waking up weary or waking up strong. But if you are one of the many who cannot sleep on their side for long, do not worry, there is another position. One that utilizes a gentle incline to protect your back, ease reflux, and even help you breathe easier through the night. Let's discuss that next. 2. The elevated back sleeper, head and knees slightly raised. For many seniors, sleeping flat on their back feels too rigid, too uncomfortable. Yet with a small modification, a gentle elevation of the head and knees, that same position can become one of the most therapeutic ways to rest and heal your body overnight. This is what doctors term the elevated back sleeper position, and for older adults, it can make the difference between agitated nights and truly restorative sleep. Take Mrs. Linda, a 73-year-old retired teacher from California. She had struggled for years with heartburn and shortness of breath. At night, she often woke up coughing, her throat scorching from acid reflux. Her cardiologist, Dr. Raymond Cho, proposed something simple. Elevate her upper body by about 30 degrees and place a small pillow under her knees to relax the lower back. The results were life-changing. Within days, Linda noticed she could breathe easier and sleep through the night without gasping or pain. Science clarifies why this functions so well. Elevating the head and chest assists gravity in doing its job, keeping stomach acid from creeping upward and airways from collapsing during sleep. According to the American Academy of Sleep Medicine, seniors who sleep with their upper body slightly raised experience fewer episodes of snoring and sleep apnea. This reduces nighttime oxygen drops that can tax the heart and damage brain cells over time. Meanwhile, elevating the knees gently eases pressure on the lumbar spine, allowing muscles to fully loosen. Dr. Cho often tells his older patients, "It is not about sleeping longer, it is about sleeping smarter." By giving your body the right angles, you are giving your heart and lungs room to function freely, even while you dream. But what if you are searching for a position that not only supports your breathing, but also rejuvenates your joints, shoulders, and even your skin? The next one, often overlooked yet powerfully restorative, might be the missing piece in your sleep routine, the starfish position. 3. The starfish position, back sleeping with arms out. There is something peaceful about lying on your back, arms gently spread to the sides, palms open, as if your body is finally letting go of the day. This is known as the starfish position, and while it might look simple, it is one of the most restorative ways for seniors to rest when done correctly. Unlike lying flat and rigid like a soldier, the starfish position gives your body liberty. It lets your shoulders open, your chest expand, and your joints release the tension they have held all day long. Take Miss Linda, a 69-year-old retired nurse from Minnesota. After decades on her feet, her shoulders ached continually, and she often woke up with neck stiffness that lasted until noon. Her chiropractor, Dr. Raymond Cole, suggested something unexpected. Try sleeping like a starfish, arms relaxed, palms up, and head supported with a contoured pillow. Linda was skeptical at first, but within a week she noticed a difference. Her neck pain eased, her shoulders felt looser, and she said, "For the first time in years, I woke up without feeling my age." Science explains why. When the arms are open and the shoulders aren't compressed beneath the body, blood flow improves to the upper spine and nerves that support the neck and hands. According to Harvard Medical School's sleep division, this posture can reduce tension headaches and help prevent nerve impingement, one of the leading causes of numbness and tingling in older adults. The position also supports calm breathing because your chest is not constricted. Oxygen moves freely, which helps lower nighttime blood pressure and soothe the heart. Dr. Cole calls it nature's reset button for the upper body. Still, not every back sleeper feels comfortable for long. Some find their lower back starts to ache, or they crave gentle support. For those seniors, there is one more position, the ultimate balance between comfort, safety, and healing. It is called the 45-degree side recline, and it might just be the healthiest way to sleep after 60. 4. The 45-degree side recline, the true senior sweet spot. Imagine lying halfway between sitting and sleeping, your upper body gently supported, your spine relaxed, your breathing effortless. That is the 45-degree side recline, a posture many geriatric specialists now call the sweet spot of senior sleep. It combines the best of both worlds, the comfort of side sleeping with the health benefits of elevation. And for people over 60, this position can be truly life-changing. Take Mr. Walter, a 78-year-old former truck driver from North Carolina. After decades of back pain, acid reflux, and shortness of breath at night, he had tried everything. New mattresses, medications, even sleeping upright in a recliner. Nothing worked. Then his physical therapist, Dr. Renee Collins, suggested this gentle adjustment. Walter positioned himself at a 45-degree angle on his left side, a firm wedge supporting his back, a small pillow between his knees, and another beneath his head to keep his neck straight. The first night, he noticed a difference. No gasping, no heartburn, no hip pain. Within a week, his sleep tracker showed longer deep sleep cycles, and for the first time in years, he woke up clear-headed and pain-free. Science confirms what Walter felt. According to research from the Journal of Geriatric Sleep Studies, this posture reduces acid reflux episodes by up to 70%. It keeps airways open to prevent snoring and sleep apnea, and supports spinal alignment, which is critical for those living with arthritis or osteoporosis. It also improves lymphatic drainage, allowing the body to remove toxins more efficiently during sleep, a process directly linked to memory and brain health. Dr. Collins often reminds her patients, sleep isn't just rest, it's recovery, and your body heals best when supported, not strained. The 45-degree side recline may look simple, but for seniors, it is a nightly act of preservation, protecting the heart, soothing the spine, and extending independence. But before we close, there is something even more powerful to understand: how all these positions together can transform not only how you sleep, but how you live. Let's bring it all together in the final conclusion, where small changes tonight could mean a stronger, sharper, more vibrant tomorrow. Final reflection. Sleep is not just rest, it is renewal. As we grow older, every night of sleep becomes more than just a pause. It becomes a form of healing. The way you sleep determines how you wake up to life itself. For seniors, the right sleeping position is not simply about comfort. It is about protecting the heart, nourishing the brain, and preserving independence for years to come. The truth is simple, yet powerful. Your body listens while you sleep, When you lie the wrong way, it quietly collects pain, stiffness, and fatigue. But when you sleep in alignment, right, supported, elevated, and balanced, your body begins to repair itself naturally. Muscles relax, joints release, your heart beats easier, and your mind wakes sharper. Doctors agree that even small changes, a pillow under your knees, a gentle incline, a shift to your left side can mean fewer aches, deeper rest, and a longer, more vibrant life. So tonight, don't just go to bed. Create your sanctuary. Let your body find its healing rhythm, because when you give your body the right rest, it gives you back something priceless: strength, clarity, and another beautiful morning to live fully. Sleep well, live well, and remember, your best years can still begin with tomorrow's sunrise. These lessons are meant to inspire you to live fully and authentically. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.